8 Benefits of Breastfeeding for both mom and baby. 1. Breast milk provides ideal nutrition for babies. Most health authorities recommend exclusive breastfeeding for at least 6 months. Continued breastfeeding is then recommended for at least 1 year, as different foods are introduced into the baby's diet. Breast milk contains everything the baby needs for the first 6 months of life, in all the right proportions. Its composition even changes according to the baby's changing needs, especially during the first month of life. During the first days after birth, the breasts produce a thick and yellowish fluid called colostrum. It's high in protein, low in sugar and loaded with beneficial compounds. Colostrum is the ideal first milk and helps the newborn's immature digestive tract develop. After the first few days, the breasts start producing larger amounts of milk as the baby's stomach grows. About the only thing that may be lacking from breast milk is vitamin D. Unless the mother has a very high intake, her breast milk will not provide enough. To compensate for this deficiency, vitamin D drops are usually recommended from the age of 2 to 4 weeks. 2. Breast milk contains important antibodies. Breast milk is loaded with antibodies that help your baby fight off viruses and bacteria. This particularly applies to colostrum, the first milk. Colostrum provides high amounts of immunoglobulin A (IgA), as well as several other antibodies. When the mother is exposed to viruses or bacteria, she starts producing antibodies. These antibodies are then secreted into the breast milk and passed to the baby during feeding. IgA protects the baby from getting sick by forming a protective layer in the baby's nose, throat and digestive system. For this reason, breastfeeding mothers with the flu may actually provide their babies with antibodies that help them fight the pathogen that is causing the sickness. Nonetheless, if you are ill, you should always practice strict hygiene. Wash your hands often and try to avoid infecting your baby. Formula doesn't provide antibody protection for babies. Numerous studies show that babies who are not breastfed are more vulnerable to health issues like pneumonia, diarrhea and infection. 3. Breast milk promotes a healthy weight. Breastfeeding promotes healthy weight gain and helps prevent childhood obesity. Studies show that obesity rates are 15 to 30% lower in breastfed babies, compared to formula-fed babies. The duration is also important, as each month of breastfeeding reduces your child's risk of future obesity by 4%. This may be due to the development of different gut bacteria. Breastfed babies have higher amounts of beneficial gut bacteria, which may affect fat storage. Babies fed on breast milk also have more leptin in their systems than formula-fed babies. Leptin is a key hormone for regulating appetite and fat storage. Breastfed babies also self-regulate their milk intake. They're better at eating only until they've satisfied their hunger, which helps them develop healthy eating patterns. 4. Breastfeeding may make children smarter. Some studies suggest there may be a difference in brain development between breastfed and formula-fed babies. This difference may be due to the physical intimacy, touch and eye contact associated with breastfeeding. Studies indicate that breastfed babies have higher intelligence scores and are less likely to develop problems with behavior and learning as they grow older. However, the most pronounced effects are seen in preterm babies, who have a higher risk of developmental issues. The research clearly shows that breastfeeding has significant positive effects on their long-term brain development. 5. Breastfeeding may help you lose weight. While some women seem to gain weight during breastfeeding, others seem to effortlessly lose weight. Although breastfeeding increases a mother's energy demands by about 500 calories per day, the body's hormonal balance is very different from normal. Because of these hormonal changes, lactating women have an increased appetite and may be more prone to storing fat for milk production. For the first 3 months after delivery, breastfeeding mothers may lose less weight than women who don't breastfeed, and they may even gain weight. However, after 3 months of lactation, they will likely experience an increase in fat burning. Beginning around 3 to 6 months after delivery, mothers who breastfeed have been shown to lose more weight than mothers who don't breastfeed. The important thing to remember is that diet and exercise are still the most important factors determining how much weight you will lose, whether lactating or not. 6. Breastfeeding helps the uterus contract. During pregnancy, your uterus grows immensely, expanding from the size of a pear to filling almost the entire space of your abdomen. After delivery, your uterus goes through a process called involution, which helps it return to its previous size. Oxytocin, a hormone that increases throughout pregnancy, helps drive this process. Your body secretes high amounts of oxytocin during labor to help deliver the baby and reduce bleeding. Oxytocin also increases during breastfeeding. It encourages uterine contractions and reduces bleeding, helping the uterus return to its previous size. Studies have also shown that mothers who breastfeed generally have less blood loss after delivery and faster involution of the uterus. 7. Mothers who breastfeed have a lower risk of depression. Postpartum depression is a type of depression that can develop shortly after childbirth. It affects up to 15% of mothers. Women who breastfeed seem less likely to develop postpartum depression, compared to mothers who wean early or do not breastfeed. However, those who experience postpartum depression early after delivery are also more likely to have trouble breastfeeding and do so for a shorter duration. Although the evidence is a bit mixed, it's known that breastfeeding causes hormonal changes that encourage maternal caregiving and bonding. One of the most pronounced changes is the increased amount of oxytocin produced during birth and breastfeeding. Oxytocin appears to have long-term anti-anxiety effects. It also encourages bonding by affecting specific brain regions that promote nurturing and relaxation. These effects may also partly explain why breastfeeding mothers have a lower rate of maternal neglect, compared to those who do not breastfeed. One study found that the rate of maternal child abuse and neglect was almost 3 times higher for mothers who did not breastfeed, compared to those who did. On that note, keep in mind that these are only statistical associations. Not breastfeeding does not mean that you will neglect your baby in any way. 8. Breastfeeding reduces your disease risk. Breastfeeding seems to provide the mother with long-term protection against cancer and several diseases. The total time a woman spends breastfeeding is linked with a reduced risk of breast and ovarian cancer. In fact, women who breastfeed for more than 12 months during their lifetime have a 28% lower risk of both breast and ovarian cancer. Each year of breastfeeding is associated with a 4.3% decrease in breast cancer risk. Recent studies also indicate that breastfeeding may protect against metabolic syndrome, a group of conditions that increase the risk of heart disease and other health problems. Women who breastfeed for 1 to 2 years over their lifetime have a 10 to 50% lower risk of high blood pressure, arthritis, high blood fats, heart disease and type 2 diabetes.